Hi everyone, thanks so much for joining us today. My name's Ed Smith and I'm the director of the T2D network at the Institute for Health System Transformation and Sustainability, or IHSTS for short. IHSTS is a small BC-based NGO, and for the past several years we've been focused on developing a provincial type 2 diabetes strategy, part of which has been the creation of the T2D network. The network's focused on the prevention, the management and remission from type 2 diabetes, and we're fortunate to have a great bunch of partners nationally that we work with. A core component of the network is education, which is why we're here today. So it brings me great pleasure to introduce Krista Lamb, who's going to be moderating our session today. Krista Lamb is a science communicator who specializes in translating complex topics into interesting and understandable stories for diverse audiences. Her first book, Beyond Banting, was released in 2021 and went on to win the Science Writers and Communicators of Canada Book Award. In addition, Krista has been the producer and host of multiple podcasts, including the award-winning Diabetes Canada podcast and How to Talk About Health. In 2025, she received a King Charles III Coronation Medal from the Royal Canadian Institute for Science in recognition of her commitment to fostering science culture in Canada. So with that, I'll hand this back over to Krista, who will introduce our guest for today. Thanks so much.
Welcome, everyone. I'm Krista Lamb, and I'm so happy to have you joining me here today for this conversation. I have a wonderful guest with me today, Dr. Shazhan Amed, and I'm so excited to learn more about the work that you're doing. So first and foremost, I'm going to get you to introduce yourself to our audience and tell them who you are and what you do.
Great. Thank you for having me today, Krista. My name is Shazhan Amed. I'm a pediatric endocrinologist, first and foremost. I've spent my entire career at BC Children's Hospital in the great city of Vancouver. And so have spent, over 20 years caring for kids living with diabetes and their families. In addition to that, I'm a clinician scientist at the BC Children's Hospital Research Institute. And I've been doing research for years and years and years using big data, system science, really with the overall purpose to improve the lives of kids living with diabetes, improve their outcomes, their experiences, so that they can thrive in this world without diabetes getting in the way. And that really has required me to understand and learn the complex issues faced by patients and clinicians in our health system and work towards finding solutions towards addressing those pain points that they face every day in their lived experience of living with type 1 diabetes. So I've spent my career doing that, and more recently have ventured on a new path as as an offshoot of my research. I am now the CEO and founder of a company called Haibu Health, which is going to be the vehicle that will commercialize a product that I will talk about today that we built through the research that I do at BC Children's, with the ultimate goal of getting this technology in the hands of as many patients living with diabetes as possible. So that's who I am.
Amazing. And that really leads into the discussion that we're going to have, which is about this technology. So I'll get you to explain a little bit about what it is. And I think people are really interested and excited right now about how we're starting to use technology and data in ways that will help people be healthier. So I'm really interested in learning more.
Great. So, the problem that we're trying to solve and have been trying to solve for a number of years is that data is underutilized in the healthcare system. And the reason for that is that it is siloed, difficult to access, and it exists in all these different places. And this applies across the healthcare system. But for people living with diabetes, this is really relevant because of the advances in diabetes technology, where patients are wearing wearables like glucose sensors and insulin pumps and generating data all the time through those wearables. And they can't easily access that data in sort of aggregate or with insights. They have to go to all these proprietary, websites. And then, they generate data in the health system every time they see a doctor or a nurse or they're, hospitalized. And that data is very difficult difficult, if not impossible, for them to see, to help them in their own self-management. And clinicians themselves, can access data, but it's all in different places. And so the time that it takes, the administrative burden of that, but most importantly, the fact that we can't see as clinicians all of the data in one place, which really limits our ability to provide holistic care. And lastly, for researchers, data is just hard to access. And when we can't access data, we can't innovate. And when we can't access data together in one place where the data is clean and labeled and indexed and high quality and usable, we actually can't leverage what's happening in the world today when it comes to innovation, and that's artificial intelligence. And how can we use that to improve the lives of our patients? And so we at BC Children's Research Institute, worked with some industry partners since 2020, actually, and built a product to sort of solve this problem of information everywhere and not in one place. We built a product. We deployed the product in a pilot study at the BC Children's Hospital Diabetes Clinic. Stay tuned. The paper will be published imminently. It has been accepted, so that's very exciting. And it was very promising. It was only in 19 families, but what families said in our qualitative data and in the quantitative data was that they felt connected, that accessing their information, whether it's their glucose data or their clinician's recommendations from their clinic appointment, or, getting tasks and forms and things to complete before clinic, help them feel connected, more prepared, empowered. And they really, enjoyed that experience of seeing their information in one place. And somewhat shockingly to me, but very promising as well, is the clinicians really appreciated and enjoyed having all of their patients' data in one place and having the ability to collaborate with these patients, on their data. And that's what that product offered. And so after that pilot, we knew that there was opportunity to make the product better, right? You don't get it right the first time. And I've learned a lot in digital health technology development. So we got another really big grant from the CIHR and Breakthrough T1D, and are very grateful for the funding that they've given us, where we've actually now built an improved and more sophisticated product. So this product actually is an end-to-end technology from the front-end user face that is a partnership with a company called Care Team Technologies, where we've customized their platform, their front-end platform that clinicians and patients can use for type 1 diabetes, where there are glucose modules, insulin pump modules, places to set goals, clinician recommendations, the ability to send out, a pre-clinic visit questionnaire, a diabetes distress survey, a transition readiness survey, to be able to really give patients that holistic experience and see all that data in one place. And so that front-end interface, however, is connected to the core of the technology, which is the back end, which receives data from wearables like Dexcom and Gluco, that is getting data from wearables, pulling it into a single backend infrastructure that is also connected to health system data. So data that exists in our EMRs that we collect every time we see patients, like their lab results, their A1Cs, their diabetes management behaviors. And all of that data exists in this backend and is then de-identified and put into this comprehensive data lake where the data is clean, it's indexed, it's cataloged, it's usable for the purposes of training AI. In order to improve care. And our first task is to train predictive machine learning algorithms that will predict a poor outcome before it happens, like a hospitalization for DKA in 90 days, predict that before it happens, a rising A1C in 90 days. Once those machine learning algorithms are validated, we will apply them into the back end so those flags can actually go directly to the patient and the clinician in their front end interface, where they can then take action before that poor outcome happens. And so our goal is really to shift our healthcare system from providing sick care to preventative care. And at the end of the day, save the system health dollars that can be deployed elsewhere for preventative medicine. So that's what we've built.
Well, it's super exciting. And it's an example of how we can be using AI for good. We often hear about the scary ways that AI is
Yes.
being used, and we don't hear about the ways that it can be used effectively and successfully in healthcare. One of the things I did want to ask about, because often when I'm talking about projects related to data, people have questions about the safety of their data. It's very
Yeah.
funny. We'll give our data to, Meta without ever thinking about it. But when it comes to medical data, there's this fear, and they don't always understand de-identified data. So I wanted to give you an opportunity to explain a little bit about how it's actually a really good opportunity to help your health by sharing this data, but also that it's protected. So I'll
Right.
give you a chance to
Yeah.
explain that.
I mean, that's a great question. And before we actually embarked on this journey of building this product, we were very intentional about understanding what does it take for patients to trust sharing their data? What does that trust look like to them? And so we actually did a lot of formative research before we embarked on this journey. And one of the studies we did was we sent a survey to 1,000 people. These were parents of kids because we were kind of focused on pediatrics across Canada and the US. And of those, about 100 were parents of kids living with type 1 diabetes. And we asked the questions around trust and sharing data and what do you need to feel comfortable that your data is safe and secure. And the highlights of that research, which was published last year in JMIR, so if anyone wants to see the paper, you can look it up, was that actually patients are really willing. People, these weren't even patients, people are very willing to share their data, their health data, for the betterment of the health system and people's lives. But what they want to see is that they're sharing their data with a trusted source. The most trusted source for them is the place where they receive their care. So it's their healthcare teams. It's the organization in which they receive their care, whether that's a hospital or a health authority. And they also trusted it when, people like us, clinicians, actually, and I don't want to say endorse it because that's not really the word, but people like us, recommend it and demonstrate how it helps us deliver better care. Interestingly, we also found that those who lived with a chronic disease, so have had experience in the health system, and this was any chronic disease, not just diabetes, were more likely to be willing to share their data. So from that research, we knew, okay, there is a level of willingness that is available to us as researchers from patients to work with them to use their data for good, right? To use their data to improve their care. From there, you really have to think about who owns the data, right? Whose data is it? Well, the patients really own their data. There are organizations, whether they're inside the health system or outside the health system, that are kind of stewards of that data. But ultimately, our philosophy is the patient owns that data. And so, to ensure that patients are in control when they onboard onto our front end interface, it is completely in their they have the agency to connect their devices or disconnect their devices. So if they want to share their Dexcom data, they connect their Dexcom. If they want to share their pump data, they connect their Gluco account. Those are the two integrations we have right now, but that would apply for any other integration we do in the future. And so the control is in the hands of the patient to share or not share their data. And when they disconnect, that data flow through that API, which is like a bridge that we've built with, Dexcom and Gluco, shuts down for them. So they're in control. And I think that's really important for a trust perspective. Of course, the technology itself and where the technology exists is also really important. So for us in this first iteration of our product, we've actually built our technology inside the Provincial Health Services Authority's server. And so all of the protections that exist around all the health data in BC, we are inside that environment to ensure that we are meeting all of the requirements for security and privacy and all of that kind of stuff. I think in the end, transparency is really important. And something that I was taught on this journey, which is, there's sort of procedural consent that we get, right? Where we, tell, these long research consent forms where we tell patients everything that we're doing and we're going to do with their stuff. And that procedural consent is really important. But there's another form of consent called substantive consent. I think I'm using the right word, which is essentially about educating patients on how their data is being used, being totally transparent, right? And that's what they want. And that's a really important piece of our work is being really open and transparent and showing them what we're using the data for, right? And to improve their healthcare experience. And then the last thing I'm going to say is trust is built through relationships, and we have co-created this product, front end and back end, with patients, families, and clinicians from the beginning. So they have been part of our journey every step of the way, where they have informed, partnered in, and actually, guided how this product was built and for what purpose. And so I think that's a really important component of the trust.
Absolutely. And I think what you said was really accurate, because people who say yes to these things often are the people who have been educated about these processes, who understand the ways that sharing this data can help themselves in their health, as well as the health of other people living with the same chronic condition. And part of that education has to be around working with people with lived experience. And so I know you've highlighted that you did it. I would just love a little bit more information about how people with lived experience were at the table for the design and the process, especially because you work with children. So it's a different thing than working with adults.
Yeah. So I mentioned sort of the formative research that we did. So the study that I talked about around trust. And then we also did surveys and lots of qualitative research with patients and clinicians. That's also being published in JMIR Parents and Pediatrics. And essentially to say, okay, what are your pain points? Tell us about your experience. We've mapped their experience and then started to sort of give them a scenario like, here is a technology, described it very high level, and said, what kinds of features and functionalities would you want in that? So we hadn't even built anything yet. We did all of this first to really understand, okay, we need to build something that's going to get used. And who are our users? Clinicians and patients. So it has to meet their needs, address their pain points. So we did all that formative research. And then in the actual building of the first product and then the second product, the first product, we did usability testing right from the beginning of developing the product. So what that looks like is you kind of build a really simple prototype, and you conduct usability. It's like a talk out loud kind of there, the patient, or in the case of this, it was a lot of caregivers like parents, and then clinicians are sort of viewing the very high level prototype and talking out loud about what they like, what they don't like, what's intuitive, what's not. Then we move to the next prototype, which is a little bit more sophisticated. It might be clickable. And so the patient or the caregiver and the clinician get the opportunity to click through it and talk out loud about like, oh, this doesn't make sense, or it'd really be great if it had this. And so we did a lot of that, which got us to our first minimal viable product. Then we did the pilot, which allowed us to gather, again, feedback from the users, the 19 users, and the clinicians who were using it in their clinical care. And that really gave us more sort of data on how to improve the product. And now with this next more sophisticated iteration of the product that is quite a bit different from the first one, but the same sort of overall purpose. We're conducting usability testing right now, where again, it's much more clickable. It's much more built out, I guess I would say, from an MVP to a second version. And so we're doing this all the time. We're going to be deploying this next product in a quasi-experimental trial in the Children's Hospital, BC Children's Hospital Diabetes Clinic. And in that trial, we are again gathering all of that sort of feedback from patients around their user experience. But then also this time we have a larger sample size. We have a control group. We're going to look at the impact of the technology on health outcomes like A1C, time in range, diabetes distress, diabetes management behaviors. In addition to that, we are also evaluating implementation, because you can build a great product, but if you don't implement it in a way that works for that local context and works in clinical workflow, no one's going to use it. And so we're doing a hybrid implementation effectiveness trial. So as much focus on the implementation piece. There's so much change management, when it comes to this kind of work. So that's how we've engaged patients and families throughout. Through some work that I do in BC, it's called the Diabetes Transformation Project. We also have a patient and parent and caregiver advisory board. So they've also advised on the direction of the project as well. Moving forward, we're just in the process of working towards re-engaging the advisory board, but expanding our engagement to equity deserving populations, because what we don't want to do is make the equity divide bigger with digital health, right? This has to serve all people. And so that's a risk that we're really mindful of. And so our engagement strategy in the next year or so is really going to focus on getting to those populations who aren't necessarily as involved in, advisories and research and that kind of stuff. How do we engage more broadly, more diversely, and capture the voices of equity deserving populations?
Such an important point, because so often the people that you want to reach don't have time or don't have awareness of these research projects, or don't really see their voices represented, so they don't get engaged. So really important that is something that you're considering, especially around technologies, because it's an area where there is already an access divide for many reasons. And we've been talking a lot about type 1 diabetes and children, and I really, because of course it is the type 2 diabetes network, I wanted to really talk about how this could be applicable in type 2 as well, especially now with more and more people using devices for type 2 like Libres and CGMs. So how would you see this down the road working with type 2 diabetes?
I mean, I think that is the most natural and obvious next step for us, is to scale into type 2 diabetes. And the reason for that is, as you mentioned, there's more technology uptake, right, in type 2 with continuous glucose monitoring and that becoming part of the guidelines, right? And so we have to acknowledge that technology is an important aspect of type 2 care, particularly for people living with type 2 who are using insulin, where continuous glucose monitoring becomes critically important for them. I see this as scaling into the type 2 population within the next few years. Definitely conducting some pilots and understanding the needs of that patient population, which we know will be different from type 1. And so there will be a need to do the formative research again, really engage that population in iterating our product, adding more features and functionalities, or focusing on certain features and functionalities that are most useful to people living with type 2. And so engaging people with lived experience, again, engaging clinicians. So that work will need to be done to make that jump into the type 2 space. But there's so much of it that's similar, right? In terms of like, my data is in all these different places. I don't have access to my information. I don't feel connected to my care team. Clinicians saying, I can't personalize my visits because I don't know what my patient needs before they walk in the door. Being able to just gather information that you can quickly look at about your patient in terms of their lived experience. I'm not talking about like their lab results. Yes, we can get those, but what are they experiencing? What are they doing? What do they need? How are they feeling? Is there any mental health comorbidity? Knowing that before the patient walks into the room is so helpful in providing patient-centered and family-centered care. So I see so much use. in the type 2 space. Of course, it's not me who's going to define what's useful. It's going to be patients and clinicians and the people who are going to use it. But I really hope I'm excited about moving into the type 2 space for both kids and adults as we continue to grow this product.
I'm going to be really interested to watch as that happens, knowing the type 1 diabetes community is one of the most engaged and active and proactive communities I've ever been lucky enough to spend time with and work with. The type 2 community can be a little more reticent because of many reasons and stigmas and so many other things. And so I'm going to be really curious to see how that rolls out, and very excited because I think it's really important. And I think that this has been such a wonderful conversation. I can't believe we're almost at the end of it. And my last question for everyone is always, is there anything that we didn't touch on that you think is important for the people watching or listening to know about your work?
I mean, I think that my greatest lesson in the last few years, as I went on this journey that, really wasn't on my roadmap. I was working with data. I was looking at population health. I was pretty happy doing that. And I, had the privilege of working with industry partners and innovators in the space of diabetes. And the realization I came to is, we can't wait for the health system to innovate because it's not going to. The health system has enough fires to deal with right now. But if we truly want to move the needle, to create a step change in diabetes care, we have to look at our partners in the private sector. And we have to say, how do we work together? And what I've been so pleasantly surprised at is how many purpose-driven entrepreneurs there are out there. And now I can put myself in that bucket, right? As a purpose-driven entrepreneur, how generous they are, how driven they are, for improving the lives of people who live with chronic disease or improving experiences in the healthcare system. There is a huge swell of activity in the space of data and AI. And I know it's scary because we hear so many scary, things in the media. And of course, does it have to be governance? Absolutely, there has to be governance. But I'm hoping that we can prove out that when there is governance, education, good partnerships with the healthcare system, like very high quality, clean and good data used to train AI, we will be able to do amazing things for patients. And I think that's been my greatest lesson that I wanted to share with everybody is, keep an open mind because, there's this kind of, particularly in pediatrics, less so in the adult world, but, this like wall that we've put up between private sector and public sector. And we got to break that wall down, right? And start to look at how we can work together to solve these complex problems that aren't going anywhere unless we really think outside of the box. So that's what I'm doing. And I'm really, really happy doing it. So I hope more people join me.
Well, I look very forward to seeing how things progress. I'm very excited that you were able to join us for this conversation today. And so thank you for that, Dr. Amed. And for everyone watching or listening, if you would like more information about the T2D network, we're going to have all of that below in the comments and show notes. Please let us know what you're thinking. And if you have questions or other things, you can leave those in the comments below. Thank you so much for joining us today.
Thank you, Krista.